Hey everybody, welcome back to Dr. Bader Knows Hollywood. It's episode 6, hard to believe. Thanks to everyone who's liked, commented, and subscribed. We're getting some really good feedback on our previous episodes, and this one's really exciting. We're actually going to do a double episode. So we're going to feature 2 celebrities today. It's going to be Madison and Scarlett Johansson. So very interesting noses, beautiful women. I really want to feature these noses because number one, they're both natural. I don't believe either one of them have been surgically altered, and they have a lot of similar features. There's just some slight differences that we'll go through, and I think you'll see that even though their noses don't fit maybe the textbook definition of perfect shape, proportions, contours, the noses really work for these women. It enhances their beauty, and I'm going to show you how similar they are, and I'll also show you a little bit of what I would do to the nose if they ever came to me for rhinoplasty. And again, this is just for fun. We're not trying to hate on anyone. I have tremendous respect for all these celebrities that we're featuring. This is more of a way for me to just educate the audience about rhinoplasty and show some noses that are famous and point out a few features that maybe you looked past. So always welcome your comments, and we look forward to this next episode. So we'll see you soon.
So let's have a look at Scarlett's frontal view. Beautiful woman. She's got a lot of really pretty feminine features. Her nose is very natural. She's got great what we call dorsal aesthetic lines, which are these ridges of light that come down from the eyebrows towards the tip. Very natural. The only complaints I have is she's got a little bit of bulbosity to her tip, something that we call a parentheses tip. So there's some unnatural shadows that live outside of where the tip ought to be. And that's something that I think could be corrected if she ever pursued rhinoplasty. So let's have a look at the morph. Again, there's some shadows here outside of the tip. We just want to bring these cartilages in, flatten them out a little bit, reorient the cartilages, really define the tip and those light reflections coming off of the tip. Overall, I think that's a nicer looking nose. You compare side by side, a little bit round, a little bit of a bulbous tip. On the other side, you've got a nicely refined tip. So looking at the profile view, really beautiful nose. She's got a really nice projected tip, great rotation, really well defined, very pretty. I really like her nose. The only thing that I would maybe complain about slightly is she's got a little bit of a convexity, a little bit of a bump on her dorsum. It's very natural looking and it works for her, but it is something that could be improved upon if she ever pursued rhinoplasty. So let's have a look at the morph again. Pretty quick and easy. You'll see that really all you need to do to make this nose gorgeous is shave down that bump just a little bit, just push that bump down, and immediately we see a great improvement in the profile overall. The tip really becomes the focal point of the nose. You can see in this side by side a little bit of a bump, not very distracting, but when we eliminate that bump, now your eye really goes to the tip. So moving on to Madison, she's got a great nose, very pretty, a lot of really nice feminine features on this frontal view. She's got great dorsal aesthetic lines, just the way Scarlett had. Really works well for her. Her nose is just a little bit more narrow naturally, but at the tip of the nose, she's a little wide, a little round, a little bit bulbous and ill-defined. So that's something that she has in common with Scarlett Johansson's nose. So when we go to the morph, we'll zoom in here and you can see these little shadows on either side of the tip. And that creates this sort of wide, ill-defined tip. When we move those in, it looks nicer, gets rid of that bulbous look. Very nice, well-defined tip. Fits very well with her face. When we look at the profile view, she's got a very nice profile. She doesn't have a bump, but the bridge of her nose is relatively straight from the beginning all the way down to the tip. And we've talked about how for the feminine nose, we actually want the bridge line to be below the tip line. And so this would be a situation where we would lower the bridge of the nose and raise the tip. In addition, she's got a little bit of excess columellar show, meaning we're seeing inside the nostril too much. So we'll go to the morph, we'll zoom in, and again, it's not as though she has a bump, we just want the bridge line to be lower than the tip. So we would push the bridge down, the dorsum down, and we would elevate and define the tip a little bit more. In addition, we need to eliminate the excess columellar show And you can see that that's a much nicer profile, much prettier, more feminine side by side. It's not a bad profile at all, but we could enhance a few of those features in order to give her a little bit more of an ideal result. You know, Madison's got a great nose, and a lot of people on the internet are speculating whether or not she's had rhinoplasty. And this is a photo online supposedly showing evidence that she's had a rhinoplasty. I don't think she has. The two photos here, you can see on the left, she's got a much wider tip, a little bit of a different frontal view. I think this can be explained by lighting, makeup, and also the fact that she's smiling on the left, which always makes the nose look a little bit wider. So I don't think she's had a rhinoplasty. In fact, she's posted online some photos supposedly proving that she hasn't had plastic surgery. She's showing a view at the bottom of the nose, which is where you'd ordinarily see an incision if she had an open rhinoplasty. I don't think this proves she hasn't had rhinoplasty, because rhinoplasty can be done with no visible incisions at all. But I do think that she has an unoperated nose that just naturally has some very nice features.
Okay, hope everyone enjoyed that. Very interesting things. We want to hear from you, of course. Comment below, like, subscribe, let us know, what did I get right, what did I get wrong? And of course, who do you want to see next? Tell us whose nose Dr. Bader should analyze next. We'll see you next time.